Dr. Drew, the host of HLN's Dr. Drew, on call, joins me now. Asphyxia, dealing with depression, suicide as of now. What can you tell us, Dr. Drew?
Well, asphyxia means depleted oxygen due to some sort of impairment of breathing. Something restricted his ability to breathe. And that happens, you know, he was an alcoholic and had been struggling recently with addiction and some relapses. If he had had, say, alcohol excess or a drug overdose, people can sometimes vomit and choke on the vomitus, but then that goes down as an overdose, asphyxia due to overdose, and no one is suggesting anything like that. Someone who's been struggling for a long time with depression, they say asphyxia, they're meaning some sort of restriction of the ability to breathe, and if it's suicide, it's self-induced.
Well, as we were speaking to Larry, you know, he talked about how openly Robin Williams would talk about his issues and talk about depression especially, and dealing with addiction issues as well. But why would someone who seemingly had the keys to the kingdom can, you know, deal with such issues is unfathomable to many people.
That's right, and Larry put it so beautifully, and you know, I can't nuance it any better than he did, that it's almost unimaginable how someone who seems to have so much joy in his life, how he brings so much joy to others, could be in a state of misery. And this is the problem with depression, and this is the problem. Listen, I was just thinking to myself how many celebrities we have to deal with now that die of mental health related conditions. He had heart disease, and yet that is not what took him. It's the mental health conditions we have to all remember are potentially fatal. Larry pointed that out again. 20 million people with this disorder, a significant percentage depressed. But it's a brain disease, and he had at least 3 things that can contribute to that. 1, he may have had a genetic heritage he'd been struggling with a long time. 2, he had heart surgery recently. Heart surgery, he even mentioned in that tape you played, the emotional vulnerability he felt, the emotionality goes to depression very often. And then finally, being somebody who had long period of sobriety, struggling with a relapse, that can often result in severe depressive symptoms.
And as we talk about when these things happen, Dr. Drew, it's time for the stigma, for us to get rid of the stigma of dealing with mental health.